Copy. What floor are you at? Alright, copy that. I will be there all right away. Yes, sir. Hey, I came as fast as I could. I heard you slipped in the hallway there because somebody didn't put a wet floor sign. I'm so sorry to hear about all that. I came as fast as I could. Sorry, my glasses, they're fogging up. Let me see if I can reposition these glasses here. But, yeah, I heard over the radio that you slipped and fell on the floor there. Because somebody didn't put a wet floor sign. That's a health hazard. Safety hazard, I mean. Yeah, you always gotta put a wet floor sign down when you're mopping and all that. But, yeah. I don't know if you could tell, I was running. I came all the way over from MCE. Yeah, from MCE, you said. So I, ran over here to this hallway, and here you are on the floor. Let me see what we got here. Let me go ahead and check your temperature just to make sure you're alive. These are the newest models that we've been informed to use. Sorry, my name is. Sorry about that. Let me just introduce myself to you. My name is Dr. Jojo. These are just the disposable ones. Let me go ahead and open it up so we can make sure everything's all good. Let me just open this disposable here, and we'll make sure you're all right. You just don't move. You're all right. Just stay still, and we'll make sure you get through this. All right. Let me just reposition my safety mask here. Might need to put some gloves on for this. You always gotta make sure you got some gloves next to you. But yeah, I was busy cleaning out one of the trash rooms, and I heard that we had somebody fall on the floor there. So I was like, okay. I didn't, it wasn't me that didn't put the wet floor sign down, but sorry about that. I tried to get here as fast as I could. No, that's my duty, is to make sure everyone's alright. Alright, let me just put some of the gloves on real quick, and I might switch over to my other glasses, but let's see what we can do here. Let me just switch over to my other glasses. These ones keep fogging up for some reason. Because this mask. You know what, I might just take the mask off at this point. There's no need for it. Because we are in a hospital setting, let me just throw on some gloves. Just to make sure we're sanitary. Yeah, I know, I've been working here for quite a while now. I love what I do. So, let me just go ahead and check your, I'm just gonna put this in your, ear here, and it'll tell me if you have a heartbeat. It's kind of new technology to us, so, sorry, this is the year 2020. Yeah, it's been quite a long time since, yeah, let me just go ahead and test that for you. Give it a second. Oh. It says you're running low on iron. You have an iron deficiency, I see. That's not good. Let me see what all we got here, just to keep you alive. I might have to put you on life support. Yeah, let me put you on life support. Let me call some more help over here, and we'll get some life support and get you all hooked up. Copy. This is Dr. Jojo. We have a patient here on the ground. I have him stabilized. We need life support stat. This is on room OR 15. Alright. So let me just let me check your eyes, make sure your eyes are okay, make sure Because when you fall and you're like running or walking and you slip and hit your head, your blood vessels in your eyes can pop a little bit. So that's just gotta make sure your vision's all right. How many fingers am I holding up? All right. How many fingers am I holding up? How many fingers? How many fingers? And how many fingers? Alright, you're doing good so far. We're doing good. Alright, let me just check your eyes. When I shine the light on your eyes, you should see your eyes, the back of your eye, just shine red. That'll detect if you've bursted any blood vessels in your eyes or anything like that, in your capillaries or anything like that. So, yeah, I think the right eye is looking a little messed up from that fall you had. The left eye over here. Yeah, the left eye is looking a little messed up too, I would say. Man, you're just all kinds of messed up from that fall there. Don't take no offense. I'm just saying, you gotta be careful. You gotta make sure. I know there was no wet floor sign, but I'm gonna go ahead and get your oxygen levels with this little meter here. Go ahead and hold out your finger here real quick. And we'll just pop that on your finger and make sure we get good oxygen levels. Alright, so while that's testing your oxygen level, let me clean up your some of your wounds on your head and your neck. We might need some scissors for that. I know we got some medical scissors. Let me show you. I'm not trying to rush or anything, but I gotta make sure all my patients and staff members are alright, because I am the manager here. So we got some medical scissors here. We're just gonna open this bag up real quick. Alright. So we gotta stop the bleeding. I need you to put pressure on. I need you to put pressure on your wound there, especially on your neck. So we've got some anemic nomicide antibiotic. Okay, we have cool gel. We're gonna need sting relief. We're gonna need a couple bandages for that, for those wounds there. Get a couple of those going. And the last, we'll get one of these square band-aids going here. Alright, so I think I got your oxygen levels all set up. I'm gonna take that off your finger here real quick. Alright, what is it saying? Okay, your oxygen levels are depleting. So we're gonna have to wheel you in on the gurney and put you in a room. Get your oxygen levels back up. In the meantime, I need you to just keep doing what you're doing. We're gonna give you non-aspirin. Non-aspirin is the best because it's PM strength. And what that'll do, that'll help with the knockout. So we're gonna go ahead and give you a couple of these. Just one will do it right now. You need one every 4 hours. That's usually the rule of thumbs. So we're gonna go ahead and pop one of these in your mouth here. Alright. So that's that. Alright, so now I think I have some gauze here we could use just to wrap around your neck and make sure you're not gonna bleed out on me here. Let me get some gauze and some wrap. Definitely gonna need some of that Neosporin because it's just one of those medicines you need to get. I might have to use some sutures on you and some stitches. I think we can get away with the butterfly stitches here. Bandages, I mean. So yeah, let me just get things going here. So let me go ahead and get this butterfly bandage on you here. That'll just help keep the wound together here, and so you don't fall apart on me. Alright, here we go. We're rocking. Cooking with oil now. So now I'm just gonna apply this butterfly bandage right here on you. Put one right there. Let me get one more, just for the other side. You were booking it through that hallway, I know. I could tell over the radio that you needed some assistance, so I came and I was the first one to show up. You're welcome. Yeah, I'm usually the best of the best here. So we'll go ahead and apply this other butterfly standard bandage right here on your eyebrow, because that's where most of the fall was impacted on. Alrighty. Let me go ahead and while you're still there, let me go ahead and take another temperature here for you, just to make sure we're going. .99. Oh, we need to lower your temperature. So, what I need you to do is take a sip of this. This right here is the magic. But it's not really the magic, so I can't let you drink that. Sorry. But we gotta get you going. I'm sorry, but we got a lot of patients in here. We got a lot going on, but let me just get you some bandages and get you into the OR9 and you'll be on your way. Don't worry, I'm just here for make sure you're alright. I'm not gonna be here for when you get into the OR5. Because OR5 will help you get everything, make sure you're stable and all that. Let me just go ahead and put some Neosporin down on this. Yeah, I was just right around the corner by MCE, so Medical Center East, if that's what that stands for. So let me just go ahead and apply some of this on you here. And get the scissors, medical scissors here, and just cut a little bit off, because we don't need all of that. It's a little bit too much to ask for, so you gotta work with what you got. So let me just go ahead and wrap this around you here. Make sure we're all kind of working together. We're working together as a team. Make the team work, make the dream work. Alright, let me see your arm here. I think you got one other thing on your arm. Yeah, sorry, it's just I got other patients to see, so I gotta make sure we're doing good. How long have I been here? I've been here for about 5 years, so I know what I'm doing. Alright, let me just go ahead, and this might sting just a little bit, but I gotta make sure we're all sterile on your arm. Alright, let me just wipe this down on you. Alright, I know it stings, let me just do that, just to make sure it's not. Let me get one more, because you're gonna need a tetanus shot right after I get this alcohol prep. Yeah, you got kind of skinned yourself on a rusted nail, so that's not good. That's never good. So yeah, I'm gonna have to give you a tetanus shot for that. Make sure we're all clean and sterile for this tetanus. Alright, let me see what we got here. We got some more medical tools right over here. Yeah, let me just put these pins and needles in you, just to make sure you're able to feel. Yeah, let me just put that one there. I got one other one I just need to put down. This will help, kind of like acupuncture. It'll help relieve all that stress. Alright, one other thing before I get going here, and before we wheel you into the OR5. So this is I'm gonna give you one of these. I'm gonna go ahead and apply an emergency survival blanket. That'll help lower your temperature here, and yeah, so I think that's all we're gonna need for that. Let me just go ahead and apply some antiseptic, some of that germicide, make sure there's no germs, no infections we're gonna be aware of. So I'll just give you some of this here. It says shake well. It's a germicidal hand rinse, so this is really good if you're gonna clean out that wound on anywhere. It's not just a hand rinse, but it's good for cleaning out wounds. Alright, so Let me get me some gauze real quick, and we'll make sure it's all cleaned up for you. Yeah, I know. I got one other Band-Aid for you. And then we'll go ahead and apply this. Actually, we'll save that for another time. We don't really need that. But what I'm gonna do with you, I'm gonna get some cotton out. And actually, you know what? Here's what we're gonna do. We are going to apply this cotton pad here. And I'm just gonna cut it in half because I don't need this whole thing, but I will just cut it down the middle. Yeah, I should have gotten me a bigger knife, but this'll do. Yeah, I know, it's pretty crazy. I'll have to talk to my boss about all those questions. Don't worry, I'll be coming back in OR5. That's the room you're gonna be staying at, is OR5. I'll come in and check on you and get your past history and whatnot, and just to see if how you're doing and all. So, alright, let me just go ahead and apply this pad. Just get it open here real quick. We'll just get that out. It's kind of like one of those absorbent pads, but it'll help stop the bleeding. So let me just get that, and then let me get the survival blanket out, and we'll be on your way to OR5. So, yep. I'm so glad I was able to come around this corner and see you here. They told me over the phone here, hey, I got patient 5 in OR5, headed to OR5. Got them stabilized. Copy that. You copy? Yeah. It's just one of those things, you know, you just gotta watch out for. You know, it's happened to everybody, so I'm making sure we're set with that. Let me get you a emergency blanket, because this will help. Because it is pretty cold inside this hospital here, so yeah, I would say it's, you know, one of those. Yes, ma'am, I do have this patient stable and under control. Copy. Alright, let me just make sure this is going to stop the bleeding here. Let's go ahead and apply that right here. Alright, let me get some tape, medical tape. Sorry, I got supplies everywhere. I came with it all. I came with it all the supplies. Sometimes they call me the supply man, because I make sure I carry everything. I'm prepared, I'm ready to go and all that. So I just dropped the Band-Aid, but we won't be needing that one. We'll just toss it. Need to get some of this medical tape. And yeah, it's pretty good stuff. Hopefully you're not. I'm gonna look at your chart. I'll have to look at your chart here and make sure you're not allergic to like latex or anything. But yeah, this is pretty good stuff. Let me just apply this. Don't need too much. It does go a little bit, goes a long way with this kind of material here. If you need anything, just please push that red button, and I'll be here quick, faster than a bird on cocaine. Alright, so let me just put that one right there. Let me get one other thing real quick. I'm gonna wrap this around your head. Yeah, let me just do that. Alright. Yeah, alright, so that should stop the bleeding. And the last thing is, I'm going to put this blanket around you just to make sure you're all warm. It gets pretty cold around these hospitals. And you'll be on your way. I'll be checking in on you, so don't go anywhere. Yeah, it's like I said, I'll have to get in touch with whoever was mopping the floors because they're supposed to. They probably knew. That's probably why they didn't put one out, because they're probably new at their job and didn't know that they needed to put a wet floor sign. But it's kind of like common sense, you know. Let me just get out. Sorry, this blanket here is kind of rough. It's like foil pretty much. Kind of see through it too. It's kind of cool. But this will reflect the sun rays and the heat that's in the room, and it'll make it nice and warm and cozy for you. So let me go ahead and wrap this around you. Gotta make this all out. Well, it won't work. There we go. There we go. How's that? How's that? Is that warm enough? Oh, how's that? Is that? You doing alright? Alright. Yes, ma'am, I got this situation all under control. You copy? Alright, so my work here is done. They will now move you over to OR 5. And from there, the nurses and doctors will make sure you're stable. Thank you.